Hi, I'm Dr. Laurie Cutno. I'm the radiation oncologist and the medical director here at the Sarah Cannon Cancer Institute at Henrico Doctors Hospital. I thought I would give you a tour of the department. We are in the waiting room, which is your first starting point. You will come here for your initial consultation. You'll arrive about 15 minutes early to fill out some routine paperwork, and then one of our nurses is going to collect you and your family members, and we are going to escort you into the clinic area where the actual consult will take place. Now we're in an exam room where the consultation will take place. The first step is one of our nurses will come in and do a quick nursing intake. They'll ask about medical history, surgeries, medications, allergies. They'll get some vital signs. Then I will come in. Before I come into the room, I will have reviewed everything about your diagnosis. I will have looked at your medical history. I will have reviewed any imaging tests that were done. I will have looked at your pathology report. I will have spoken to any other doctors that may be involved in your care so that we can get everything coordinated. And most importantly, I will have formulated what I think to be the best radiation plan for you. I will then come in and I will talk about that plan with you. I will tell you how many radiation treatments are required, what that's going to look like. I will describe the basics of radiation therapy, that it is a daily X-ray treatment. It's done on weekdays only, no Saturdays and Sundays. It can take anywhere from 10 minutes of treatment up to 45 minutes, depending on the complexity of treatment. I'll tell you you're going to be treated lying on your back on a flat table, that there's going to be a big machine that's going to move around you, but nothing is going to touch you, that you won't see or feel anything during treatment. And we'll talk about how the side effects of radiation therapy are going to be confined only to the area where we are treating. In other words, because radiation is a localized treatment, if I'm treating you for breast cancer, the only side effects you will experience are going to be within the breast. If I'm treating, say, for a lung cancer, side effects are going to be related to irritation of other organs in the chest, like the esophagus. If I'm treating for a pelvic malignancy, the side effects are going to be confined to the pelvis, say diarrhea. But if I'm treating for a pelvic malignancy, we wouldn't expect any side effects elsewhere. So we usually don't see hair loss with radiation therapy, and we usually don't see compromise of the immune system. The next step is going to be treatment planning. Nowadays, radiation therapy is all based on a three-dimensional model of that person's body that we build in our computer system, and that's what we base our planning on, and that's how we come up with an optimal radiation plan for each patient. So the next step is a planning appointment that also takes place here in our department. Sometimes we have to take a few days between the consultation and the treatment planning appointment because we might have to ask for authorization from an insurance company. The next appointment is going to be right down the hall. This is our CT scanner room, so this is where we're going to figure out how to immobilize or keep you still during treatment. So in general, we are going to, based on what we're treating, need to keep you still. So we may need to create an immobilization mask for you. There are various different types. They are all made of special plastic material, which is fairly rigid at room temperature, but it gets soft and pliable if we warm it up. And so if we are treating you above the jaw, you're generally going to need one of these. If we're treating you below the jaw, don't worry, you're not going to need one of these. But this is part of what we're going to need to do when we do a treatment planning scan, to make sure that each and every day for radiation therapy that we're positioning you accurately and that you're not able to move during treatment. We also might create a special mold around your body. This is called a vac-lock bag, and they're kind of like very fancy bean bags, but if we suck all of the air out of them, they will keep a shape. You can kind of get the feeling that this is where a patient's legs go. Again, that's to make sure that we're positioning you in a way that is consistent each day and that there's no movement during treatment. After we create the immobilization devices, we are going to do a CT scan of the part of the body to be treated, and that's going to allow us to create a three-dimensional model of that part of your body in our computer system, and that's how we're going to generate your customized radiation plan. So this process can take anywhere from 20 minutes for very simple treatments, all the way up to an hour and a half. The longer CT scans are going to be related to tumors which might move as you breathe. That's going to require a series of CT scans so that we can generate what is essentially a movie of your body, so that we can track how things move as you breathe, because as long as I know how it's moving, I can account for that. After we do the scan, we're going to need to do some computer work to get everything perfected for you. That can take anywhere from 1 to 2 business days for simple treatments, all the way up to 1.5 to 2 weeks for more complicated treatments. But it is worth it because we do need time to get everything perfect. This is our treatment room. We have 2. This is where you will be getting your treatments on a daily basis. This is a radiation machine. We call it a linear accelerator. It generates high energy X-rays, which are then what's used to kill your cancer. You will be positioned every day by a team of radiation therapists on this table here. This machine will go around you in a circle. Nothing is going to touch you. You're not going to see or feel anything during a treatment because radiation is invisible and painless.